Good morning, welcome. Just going to wait a few moments for others to join. Welcome, colleagues. Welcome. Good morning. We'd love to hear from you. If you can pop into the chat where you're joining us from, that would be great. Morning, colleagues. And for those who are joining us for the first time, this is the Early Childhood Systems Perspectives Research webinar series brought to you by Ilifa Labantwana Research on Socioeconomic Policy, that's RESEP at Stellenbosch University, and Data Drive. I am Elizabeth Baini. I'll be facilitating this morning's discussion. Welcome. Fantastic. All right, so for us, for this webinar series, our aim is to explore the latest perspectives and research on all issues affecting the early childhood development service delivery ecosystem. And of course, as always, to create change for children through the promotion of data and research. So it is exciting today because we are bringing you a different angle from what the sector is used to. We are changing gears a little bit, and we are moving slightly from early learning to health. And today's discussion will be centered around the Road-to-Health Booklet, which is a primary tool for health workers and caregivers to track key health metrics like weight, height, nutrition, and other developmental milestones to help identify children who are in need of early care before the problem escalates, right? But with this important tool, we are beginning to see concerns over its potential as a preventative care tool, particularly for the early detection of stunting and malnutrition because of its usage. So in a country where 1 in every 4 children is currently stunted, we want to explore some of the gaps and possible ways to strengthen this vital tool to address these issues before it becomes an insurmountable, challenge. And this morning, it is with great pleasure that I welcome Dr. Jessica Ronaasen, known to the sector as Dr. Jess, to help us to unpack some of the gaps that we are seeing and discuss possible solutions to strengthen the Road-to-Health Booklet. Just a little something about Dr. Jess. So Jessica Ronaasen is a social worker, a researcher, an ECD advocate with extensive experience in program development, training, facilitation, and monitoring and evaluation within the ECD sector. She has contributed to the development of UNICEF and the Department of Health nutrition guidelines for ECD centers, and has supported various training programs that supports child health and nutrition. A very interesting fact, she has launched the Relate Your Research, which is a social work podcast that makes research accessible and engaging. She's very much interested in all things ECD, nutrition, and fostering an integrated service for young children. So we are in great hands this morning, and it is with great pleasure that I invite Dr. Ronaasen to help us to unpack their findings from the appraisal of the completeness of the Road-to-Health Booklet, a study which they conducted in the Eastern Cape, and which the findings of which are relevant to every part of the country and for our agenda to end stunting by 2030. Before she begins, just a couple of housekeeping. This webinar has been recorded. It shall be shared with attendees and interested parties. Please keep your questions in the Q&A although we monitor the chats, we might miss some of your questions. So if you could kindly put it in the question and answer tab, or when the time comes for engagement, you can equally raise your hand and we will try and give you the opportunity to ask any and all questions that you might have. Without wasting any further time, Dr. Jess, over to you. Looking forward to it.
Thank you, thank you. And yeah, what a privilege to be with you all this morning, colleagues, friends, the sector, academics. It's so wonderful to see everyone popping into the chat. And yeah, thank you for that introduction. I know you all had many places you could be for this hour, and so I really just want to acknowledge and thank you for joining us, and a real shout out to the ELIFA and the Data Drive team for creating a space where research can be engaged upon, and where we as a sector, for the ECD sector specifically, can zoom in on projects such as this one. So I am sharing my screen. There we go. And just to say that this study was an interdisciplinary study. What is so wonderful about linking and integrating health with education, with social work development perspectives and statistics, is that it really birthed this interest of mine into this interdisciplinary perspective. So it's a challenge to sometimes present on behalf of such a diverse team. And so just to say, this was a joint collaborative effort, and I'm very proud to be presenting on behalf of nursing science interest, as I shared, statistics, social work, nutrition, and child health. It all began with wanting to determine whether or not the Road to Health book was being accurately completed. And so the nursing students from Nelson Mandela University put together a project around how do we engage the health kind of interest and outreach in ECD settings in a way that would showcase gaps. And so the aim of the study that I'm going to be sharing with you today was about exposing and showcasing nursing students to an ECD sector outside of a clinic facility, and utilizing the sample of ECD centers, which I'll share with you a bit more about, so that we could combine a research and practice conversation. And that's exactly what happened. What was amazing was to see that by auditing these Road to Health books, we were able to generate a message that was then ideally suited for a call for articles into Development South Africa, which is where this article then found its home, really claiming the practical kind of on the ground lens and bringing that perspective of what it looks like to do an audit of this nature. For some of you on the call, you might not actually know what the Road to Health book is, or perhaps you came interested for that, or where Side by Side fits in. It's so lovely to see some of the colleagues on the call who I'm sure would give far more depth to this. But for your crash course, the National Scaled Road to Health book, which used to be referred to as a clinic card, or sometimes is still referred to as a clinic card, was intended to track the growth and support parents in being able to integrate into the health services with a record of some kind. So this is the record book. You can showcase detection of growth, and we'll talk a lot about that today. What was so amazing about this child health communication strategy of Side by Side was that they integrated the nurturing care pillars into the communication and into the Road to Health book. And so, yes, while this is a nutrition conversation and a child health interest, there's also an element of responsive care, of child protection and healthcare. And I think that is a conversation that the ECD sector starts to sit up about, because we are so driven by integrated services. The ECD policy talks to that, and we know that the impacts do develop an impact on early learning. So this booklet was intended to empower caregivers and walk that journey from birth to 6. So what we see, and maybe before I kind of dive into what we found, is to answer the question, what would complete look like? And so our research team asked that question. I put some practical examples there for you, and it is exactly what you expect. It's dates in place, measurements taken, complete at the right time. And so timing makes a big difference, and you'll see that in the results that I share with you today. It also means that every part of the Road to Health book is complete. And while for the purposes of the article, we really zoomed in on the height and the weight and the vaccinations, deworming, and immunizations, and vitamin A, we don't by any means mean to forget that there are other sections such as the head circumference, MUAC, or developmental screening, all super important when it comes to the completeness of this book. And I believe there are many people on this call who would show different interests in different sections. So just to say that. What would complete look like? And the data will tell us more. But complete looks like what you're seeing. It's ticks, it's many of them to showcase that visits were held at the local clinic and the correct intervention was given at the right time, whether that is deworming or in vitamin A, and the plots are correct and that they are where they need to be. Accuracy was not what we were after. It's very difficult to go back and look in retrospect, but so for the purpose of this audit, we were looking for completeness. To also set the scene in South Africa, we often hear the stats around 25% of children in South Africa are found stunted, and that was very much the call for abstracts was around ending stunting and identifying stunting early. We see growth faltering where growth is not continuing at a trajectory or that of what we would expect. And that often begins before it's visible, before you can see it. But what is really interesting is because of the timing and the intervals of the Road to Health book, you would be able to track and start to see the trends if you have that data in front of you and that information in front of you. We often see that this is an early warning system and we have it, but the nature of nurturing care is that it's not just a health issue. We want to be able to empower parents and ECD practitioners to be able to see that, yes, this is a health issue. It's also an issue that has reaching effects into nurturing care. And while we assume there may be implementation gaps, and you often hear about them, this study was really looking to see what are these gaps specifically that are affecting the stunting conversation and presents us an opportunity to respond. If you go deep into the article, you'll also see that we really position some of the concepts as opportunities for interdisciplinary work. It was so fascinating to watch different disciplines within our research team engage around what is the Road to Health book? Is it a tool? Is it an intervention? Is it a communication strategy? And this tool is often collected at centers upon admission or annually. So the ECD practitioners are actually quite familiar with the tool. The question is what's inside just as familiar to them as the tick box exercise of collecting it? And that is, I suppose, an underlying question, but very interesting to see as the different disciplines came in, whether it was the nursing students or from the sector itself, to see what was most interesting. We also explored malnutrition, growth monitoring as a skill and an intervention, and where do immunizations and deworming fit in. I'm not going to go into too much detail, but I thought it was a good flag post for this webinar. So the design and the framework of the study was held in Nelson Mandela Bay in two specific districts, in these two sub-districts of Nelson Mandela Bay. And the reason for that was for ease of access as well as safety. We had a good network within these two districts, and it makes sense that there were already hubs and non-profits working in these areas. I think what was interesting within this quantitative study was the 1,337 Road to Health books from 85 ECD centers The nurses got very excited about this because often Road to Health books may be forgotten, they may be lost. There are a number of reasons in practice that we see Road to Health books not always entering the system or being captured. And so this was a wonderful opportunity to get a sample of this size. And the tool that we used was a structured checklist aligned to the Road to Health book. So you can see our breakdown there. We got asked the question quite often, why ECD centers and why we weren't utilizing the clinics. And this really was to showcase that there is a key community space where children and caregivers and these records are converging outside of clinic settings, and that this is an opportunity and a space for us to support the community outreach rather than focus on the facilities. So that was part of the discussion and decision making. Great. So let's zoom in a little bit. While we've positioned the concepts, we've talked about the kind of setting. It's helpful to take a minute to kind of look through the numbers here, and if we look at the results, we see completion rate popping out to see, yes, at birth, we're seeing that height is recorded, that weight is recorded, but over time, what you see is that there is a decrease in the recording of weight, of height, and the birth, yes, because they're in a facility. But that requirement after the 6 weeks, we start to see a dropout rate. Everyone fills the card in the beginning. I think that's my message today. And at 6 weeks, we're still seeing some positive outcomes. Then what starts to happen from week 10 until about the 18th week is that we see a strong decline. And this is where I think it's an interesting conversation for us as a sector, because this is often when mothers have to go back to work, or what is preventing mothers from taking their child back either on time or to complete the book and the sections of the Road to Health book. I'm going to dive a little bit more into the implications in future slides, but just to kind of take a moment to see graphs completed accurately throughout. 68% of them were not for weight, and 96% were not for height. And so we start to see a real challenge over time. Have a look at the vitamin A and deworming, and we see a very similar situation. The BCG, specifically in the first 7 days, we are met at the targeted window. The vaccinations gets very technical, and I cannot claim to be a medical professional in this light. And I think we're not asking ECD practitioners to be either. So if you're on the call and you're like, what is BCG? I think what is significant for us to understand is there is a protocol of immunizations that are prescribed in the extended program for South Africa. And the idea was always for blanket. We always wanted the whole country to receive this at birth, at 6 weeks, at 10 weeks. And so the timing of these vaccinations is critical. What we saw is that there were late vaccinations, 3 weeks late, 2 weeks late, 1 week late, or within the window. And similarly, the early vaccinations being far more on time than the later ones. And this happened with the other vaccinations. Many children seen within the first 7 days, more, and they're seen more than in any other period. So this starts to signal to us something is working in the early days, and then as time goes on, something in this particular sample was not happening or not recorded. Similarly, in South African studies, they actually found the same, even in women with vitamin A. Over time, early detection, yes, and then the dropout rate. And so it doesn't come as a shock. What we also needed to note, and the nurses also shared a bit about this, is around the deworming often not having stock at clinics. And so, the stockouts issue that does also come about could also explain some of these findings. So what is going well and what is not going well? And of course, you can dive deeper into the article if you are interested. What is often overlooked here is the incomplete part. So yes, it's a clinic issue, but this is actually, if we zoom out as a sector, 80% of early vaccinations recorded and consistently documented. We must celebrate that. That is a good thing for our first 1,000 days argument. And of course, we want mothers to be supported and young children to be supported in the early days. The system is performing for them because we're seeing a complete document. And at birth, we're impressed to see that, right? That's what we want. That's what you would want for your child, and it's what we want for the children of our country. What is not going so well is that the documentation is declining as the children get older, and that the length is often recorded at less than 5% after infancy. There will be many, many reasons for this, some more critical than others, but this is the conversation that I'm hoping we can have today and the learning that we can have today. That weight for length or height graphs that are showing absent is actually very low, 3% over time. And so in some places they record the weight, but not the height. And so this is missing data. We have to ask why, and we may not always know the answer, but we shouldn't assume, and we can assume that their child was growing, but we have no data to prove it. And I think that's a part of the conversation. So in reality, that means that recording weight is not going to find stunting because we don't have a height record. And these are critical indicators more than just tick box exercises, and we'll zoom in a bit more about that. I think that the tick box exercise is, we can all agree, not enough. Like enough is insufficient for adequate healthcare services, and these are critical indicators in a complex system. What we see, if something isn't measured, it isn't prioritized and difficult to respond to. And so, yeah, shout out to Jess Horler for really opening my mind around this, is that this measurement is a signal to the system. And if we're talking about ending stunting, then height should be a priority and vaccinations should be on the agenda too. By reducing our warning sign that something is incomplete, we miss the warning sign as a system too. So I'm hoping we're going to have a very rich conversation today around the missed opportunity that we have for early detection, but also for highlighting the need for completeness. And this is less about a blame game than it is about taking responsibility and finding more opportunities to complete the Road to Health book, because often what you hear is this Road to Health book is for the clinics or for the nurses, and that is not true. So what we saw in the results, and I've pulled it out here, is that 58% was recorded for vitamin A and only a 42% recorded for deworming. I guess I asked the question, would you want your child to be in that batch of recorded or in the batch of unrecorded or incomplete? And it has to be personal, because we do want a response and an action to this. 58% and 42% isn't good enough, really, for such a large sample. And so we have to ask ourselves the question, as I said, less about the blame and more about the action. So we need to talk about that incompleteness and talk about prevention strategies. I think that, I guess with my advocacy hat on, is where I kick into passion. But the statistics are speaking here, and weight is clearly a focus, and the height that measures much lower are neglected. So we missed that opportunity, which was exactly what this call for the article was about, and the message we hope to share. If we're not plotting, we can't see the trend. I think, when I was chatting with Elizabeth about the webinar, she was showcasing to me the links for early learning. And so I thought, let me also share that we know that stunting is linked to concentration, cognitive development, executive functioning, I wonder if Kaylee is on the call. Shout out for you as well, and all the executive functioning work, and school readiness ultimately. But that begins way before that child is entering formal schooling years. And this study showed again that we can utilize these health data points to be able to strengthen actually the school readiness opportunity. Incomplete data creates a hidden developmental risk. We know that the height and the weight together would reveal stunting. And so this is like, let's catch this before it becomes a problem, rather than waiting for the problem to arrive or the issue of stunting to increase. Yeah, the caregivers are definitely a critical conversation for us to have, and I'm hoping that we do, because while they often are talked about, are we giving agency to parents to be able to utilize these books, and how better might we do that? Centers can strengthen referral and caregiver engagement, and caregivers are ultimately yes, they are the holders of these documents, but they should also have the agency to utilize them to advocate for services. And of course, learning spaces to function as protective health hubs. And I'm hearing this term pop up more and more these days, just around, while we don't expect ECD practitioners to be community health workers, we're not asking for them to be health professionals, but there's definitely a convergence of these critical populations that we can support and strengthen as a system. So moving on to then talk about some of the recommendations. The article speaks about the role of the Road to Health book as a scalable tool, and inadequate recording practices by the healthcare system could result in incomplete Road to Health book, and then that fails to prevent malnutrition, directly linking to the call for the articles themselves. And we know that height for weight is an indicator that is needed to be prioritized, and the WHO does speak about this. There may be many reasons, and the reasons were not what we were exploring here, but I do think there are practice implications for that. We also want to empower caregivers and professionals through training about accurate completion, that parent can ask, please, can you complete this? Or is there a reason that this isn't completed today? And training gaps can also support growth and understanding around measurement and interpretation. There are training packages, the nutrition guidelines for ECD programs, and the training package and toolkit, as well as policies like the infant and young child policies that continue to prioritize growth monitoring. We see the healthcare system, the education system, and the social development system all converging here. And there are definitely practical opportunities for us to talk about. Those who work in caregiver support, we need to be viewing, and the recommendation is to equip and support these record holders, but also primary caregivers, that if they're not feeling fully empowered, or like the book isn't theirs, then we're missing an opportunity for them to engage more closely with why theirs is incomplete. And that limited support to interpret or question. Health should happen, and why isn't it? Height should happen, I mean. Caregiver education continues to yield results for completeness. And I think that's helpful when you start to hear parents say, anecdotally, I didn't know this book. I could use this book. I didn't know it was for me. And then from a basic education perspective, we could utilize these sites as early identification settings. And I think as the integrated kind of methodology becomes more and more what we're idealizing as a sector, we should have health services that see ECD centers as a space in which they can support. Roadshows and community health based outreach initiatives should definitely consider ECD centers as a space. And then of course the healthcare systems, we want the nurses and the doctors and the health professionals, allieds included, to be taking a proactive approach towards completeness. So we can ensure weight and length are captured, and that we can ensure, all the sections, and that's why I shared at the beginning. We don't want to neglect the developmental screening, because those are opportunities for special needs children to be early identified and supported, or parents to better understand the growth of their child that they see every day. So if you take one thing from this entire presentation, it would be this slide. This is the slide. The slide that says this is not just a health conversation. This really is a conversation for a existing initiative that is supported by Department of Health, and a conversation and a tool that allows us to have a engaged interdisciplinary conversation where we want a call to action to emphasize that this is more than just health professionals that could utilize this book. And the key takeaway around incompleteness is that if services weren't rendered, we need to be speaking up. And if they were rendered and the book is still incomplete, we need to be talking about why. So I'm hoping that this has sparked and inspired some interesting conversations, and I will leave it there. Let's learn together.
Great. Thank you, Dr. Jess. And of course, we've shared the link to the full paper for those interested in the minute details as well. This is a very interesting conversation we are having this morning, and it's exciting if not for the fact that we are connecting all the different parts, components that make up a holistic solution for young children. So we are not looking at kids in silos, early learning, and then this and then that, but they're all interconnected issues that we can address simultaneously to be able to get them to thrive by 5. All right, so we've got a couple of questions in the Q&A box. I'm also wondering if perhaps our people posing the questions I'm offering an opportunity for them to unmute or to be unmuted, and then they can ask their question directly. So if Dorette Lau, if you are available and willing, please put up your hand, and then we'll give you an opportunity to ask your question directly. Yes, ma'am, come through.
Mm-hmm. Hi, thank you. Yes, my question is around just understanding how the Road-to-Health booklets were present in the ECDs that were part of the study. It's about them just understanding. I always thought that the caregivers were the custodians of this booklet. So just to understand how they made it to the ECDs in the study.
Perfect.
Thanks.
Yeah, thank you for asking that question, and perhaps a missed moment for me to unpack that detail. So it was requested that the parents bring or send the Road-to-Health book on that specific day for the study to be completed. There was also a number of gatekeeping opportunities and consent that needed to happen in order to access those records. The centers themselves, however, do also collect copies at some point. Not all centers, it's not a requirement, and I think I did see that as a question. I haven't been deep in the question section, but I did see that as part of the question. I don't think it was ever a requirement, but many centers on admission ask for a copy of the Road-to-Health book, and so. But whether or not that's a tick box exercise or if they utilize the data inside, I guess I can't really comment on that. But the centers are aware of the Road-to-Health book.
Okay, I suppose I'm going to take advantage of my position. And as a piggyback to that specific question, I'm wondering if we have considered what specific training or resources that ECD practitioners would require to act as effective early warning systems, right? Without overstepping the educational mandate. Mind you, they have a primary purpose, but if we are to take advantage of their pivotal role as like a potential early warning systems for caregivers to be able to access interventions before it escalates, what specific training or resources are we thinking that we could equip HCD practitioners with? And then I would take Takani Mabasa, if he's also available, you can raise your hand and we'll give you access to ask the next question. So over to you, Dr. Jess.
Perfect. I think on the conversation of training and materials, I mean, on the call are so many incredible organizations represented who are doing the most remarkable work in the health, child health space and ECD training space. What Side by Side has done so well is create a number of useful, accessible online materials. I can even post one into the chat. There's literally a guide for ECD practitioners and childcare workers guide that really goes section by section, unpacking a little bit more detail, I suppose, than the Road to Health book itself, and what might be interesting, important, or useful for an ECD practitioner. This could be used as a training manual. And then we know that the guidelines also have a training manual, and there are a number of government initiatives that also support training. A number of the community dietitians that I've come across, specifically in the Eastern Cape, do ECD practitioner training routinely. So that is, I think, progressive and supportive. Grow Great have also done some amazing. I mean, you could go down the list of organizations who have been significantly impactful in their training of healthcare workers, community healthcare workers, and all the way up, really. And there's even been some interesting online university endorsed programs over the last while that do also focus on upskilling and supporting training. So I don't think it's a lack of training materials. Yes, so that they are accessible and around. So, I guess the question is, who is championing this, and how often are we doing that? Are we making provision for it, and do those who fund the sector, specifically in early learning, are they also seeing the relevance of supporting health services or parent support programs that link into health and nutrition?
I hear you loud and clear. Takani, please come through with your question. We can't hear you if you are speaking or unmuted. All right. So while we wait for Takani to sort his mic out, there's a question from Andy Dow that is speaking about stunting measurement. And Andy, if you can unmute and ask your question.
Yeah, I'm unmuted. Can you hear me?
Yes, perfect.
Hi, Andy.
Hello. Hi. Hello, everyone. Just a note that I put in there in the Q&A is one of the reasons why you don't have the data. There are many reasons, but one of the key reasons is that the clinics don't have the kit to do it properly. It's something I discovered in the Eastern Cape working there years ago with Linda Biersteker, where we were measuring height and weight, amongst other things. And often the clinics did not have length boards or scales or stadiometers. So obviously they couldn't record this and they couldn't track it. So I wondered whether you had observed this, and if so, whether you would include something like this in your recommendations. Thanks very much.
Nice. So helpful and very real. It would be interesting to hear from the nursing perspective, their experiences of access to tools and equipment. We also did note that because we were in the ECD centers, you wouldn't expect those tools to be present. So I suppose from the study perspective, it's difficult to see, but we are making that linkage right back to the health facilities. So yeah, it makes sense that it may be around actual resources at the center, at the facility, but it is interesting that the weight is being tracked. So there is a scale. I guess then the question is around the height. Yeah.
All right. So while
An
we are
agreement
raising
than a comment, but yes.
All right. So the developmental milestones in the Road to Health booklet, what are your thoughts? Do we think it's specific enough for nursing staff to use? Because these are also important in identifying stunting. So that is one of the questions. And I suppose when you're responding to that, you could also briefly respond to whether or not you recorded damage or missing records at the centers, and perhaps some of the reasons for those difficulties. Yeah.
You almost to frame it, it's like even missing books is data for sure. And so we didn't track children who didn't bring their books. We were auditing the books that were present, but perhaps that is a further study to explore. And then on the milestones, I think that's such a relevant conversation for this group to engage around, because those developmental milestones are what connects so many of us to this topic, and an area that we are working so deeply with. I see, one of my co-authors is also on the call, so perhaps she would also like to comment around some of these things. But to say that I think training around that specific section, the developmental milestones, is often missed, or it's like a section that can be very easily skimmed over because it hasn't historically been a health driven page, because the developmental milestones were potentially considered actually an education, like, oh, they'll find that out in school, like someone will assess this later, or requires an allied to be able to make those assessments. And so it's possible that further training specifically of the health professionals or health care workers at the time with that child wasn't in place or wasn't sufficient. So yeah.
All right.
Education there too.
Yes, we're going to give Margaret Williams a moment to also contribute to the health conversation, or the some of the nitty-gritties there. So Margaret, if you could raise your hand, and we'll give you an opportunity to come through, and then we will give John Kruger an opportunity to ask his questions after Margaret has given some insights. Thank you.
Hi, can you hear me?
Yes.
Right. Oh, great. Hi. Morning, everyone. Which one do you want me to start with? CHWs are used in clinics and are often used in outreach, but not so much with the childcare. So on the pediatric side of most clinics that I've been to or worked with my students, it does tend to be somebody that has some pediatric knowledge that will work there. The biggest problem that we would find on the urban side, we do have scales, and there are measuring boards, and there are also the measurements where the child can, will stand against the wall and we measure. So those are available in most of the clinics. I think the rural areas maybe have more challenges with that. But the biggest problem I used to pick up is if the person who's not working normally with the pediatrics is off sick or isn't available, nobody steps in. So every single parent that brings their child on a day like that will be sent home. I'm not sure if that's actually improved, but that has been a problem in the past that I've noticed, and I suspect in some clinics it might continue. And the challenge is to continue with advanced primary healthcare training for staff, because a lot of the staff working in clinics are not, they don't have the qualification of advanced primary healthcare, and they are not comfortable working with children. So that is something that we're still going to be battling quite a bit with going forward, especially in the Eastern Cape, because we're not currently training advanced primary healthcare practitioners. And other universities that have been accredited. I don't think this audience would be aware, but there's been a whole shuffle in nursing qualifications, where SANC has changed all our qualifications. Not that like my qualifications just disappear. There's just different articulation in place at the moment in how you get, and they've redone the courses. So in other words, try to more standardize the advanced training, like for ICU, for nursing admin, education, and primary healthcare, midwifery are the main ones, psychiatry, that we're looking at. And so every single university has had to reapply to train and to put in a new curriculum. And because of that, there's a bit of a hold up with all training at the moment. So I've heard from quite a few people, for instance, people from the Eastern Cape are trying to get in at the Free State. So just to put that into context for you, we are having a little bit of a crisis with trying to get people in place who do know what they're doing in primary healthcare. So,
all right. Thank you so much for that invaluable insight. It's great to have the multidisciplinary perspective happening in real life as well. I wonder if, John, you can unmute to ask your question. And then for those who are asking for more resources and links to the full paper and the training manuals, we've put the links in the chat for you. So please do look in the chat. There are links to the actual paper and to the resources that Dr. Jess was referring to help ECD practitioners who are interested. John, can you ask your question?
Yes, I've unmuted. Can you hear me?
Yes, perfect.
Yes, thank you very much to Jessica and the team. It's a fascinating study, and as you rightly say, focusing on a very important instrument. Just to add a bit to the interdisciplinary part of this, I've recently been looking at the Road-to-Health book as part of the screening process for disability and for impairment. So there's also space in the book for that, and clearly it could play a much bigger role in screening and then also supporting disabled children. So, you know, at some stage it would be good to also look at that part of the book and how complete that is. But then also just saying, you know, you call it a tool, but I think it's in a sense more than a tool. It's really the backbone of that maternal, neonatal, child and healthcare system. It is the operational, it is the information that sits on the top of those operations. So it is a very key part of the system, not just a simple tool. It's really the backbone of that maternal care system. And if it's not working well, then the maternal and child health system is not going to work well, and everything that depends on it. So thinking just about the incompleteness as well, and we've had the equipment and so on, but I've recently had the opportunity to visit some clinics in the Eastern Cape, Motherwell and around there. And of course, nurses are under a lot of pressure, a lot of work, and part of it is paperwork. So they've got the Road-to-Health book that is paper. Don't know if people have seen it, a massive, what they call tick register that they must complete for every patient and so on. So there's real pressures there. And in that context, partly I've wondered about digitization. Have you seen any efforts around digitization or linking with digital system that would reduce the pressure on the nurses? And I think there are big issues about what digitization would give us in terms of saving time and so on also, but then the Road-to-Health book is also a very concrete tool, as you said. So The question is, have you been thinking about digitization of such an important tool? Thanks.
All right. Thank you, John. And also, while you prepare to answer that specific question, there's also a suggestion, and I think it's a great one. It's about resourcing ECD centers with scales and height charts. This is seen as a low-hanging fruit recommendation to aid in the completeness of weight and height recording. Something to consider as well. Is it possible? Is it as low-hanging as it appears? So yes, perhaps we respond to John's question, and then I wonder if, Colin, you can raise your hand, and then we'll give you an opportunity to ask your questions after.
Great. I mean, such rich contributions, and I'm so inspired again to the multidisciplinary kind of approach, is that there's definitely not one perspective here that should crowd out another. And I think I've been so appreciative of reading through some of the comments, just the different perspectives coming through. I think the work with disability is super critical, and again, it is positive that is referenced in the Road to Health book. Whether or not that's sufficient, also providing the sector with enough warning signs or easy to use, user-friendly tool. I mean, that's perhaps another conversation. And I'm also appreciative of how often special needs is being raised on these specific webinars, that this is an area and a recommendation for us as training organizations or as those working in public health to be looking at also. So we didn't directly look at that. And I haven't seen the digitalization kind of comments come, or specifically in our study or in the work that I've been doing. It's very much been in the concrete, tangible booklet in the hand. And I think there is something very empowering about that when you're standing in a clinic as a parent, to have that book and know what it says and what you're hoping to gain by entering that clinic looking for services. So I think there's a comment around support and the agency that the physical booklet gives you versus an online version. But definitely as we move into a technological age of kind of developments, it's not to say that we shouldn't be using technology to further support. How that looks in rural areas, hard to reach areas, that's always where your limitations will come. It's so amazing also to see all the work being done in the Eastern Cape, and this project coming directly out of Nelson Mandela University also speaks to that. It's wonderful to see institutions, tertiary institutions, seeing the ECD sector as a space to do research and to make these recommendations. So the idea with the article was really to bring that voice to the stunting conversation, and for the Road to Health book not to be a neglected instrument, as you mentioned it. And you're quite right. I'm seeing it as a tool, you're seeing it as an instrument, and it is in essence the backbone, because that is it's the framework upon which that child is traveling through the healthcare system over time. And I think that's where my perspective has shifted so much over the years, to see how valuable that is to a parent at any stage, whether it is the early days or later on.
The chats are ablaze with comments, questions.
Of course.
It's very excited, but
unfortunately
we can engage you all and everything. So I'll give an opportunity for Colin to ask his question, and afterwards Colleen Kellerman to also come through, and then we will see how much we can get through. But I suspect there will be a lot of communication emails to you after this webinar.
Absolutely.
Colin?
Thanks, Dr. Jess. My question is about whether, I can't remember the table you showed about vaccination or deworming rates as measured by the Road to Health booklet. But did you compare them to the same rates as measured by the DHIS or in the health barometer, to see whether it's indeed a recording issue or actually there's some kind of problem that there are actually low rates of coverage of the important interventions?
I'll have to go and look a little bit more closely, but what I do recall from when we were writing up the paper was we did do comparisons, and it was quite a line. Like it wasn't far off from what we had compared, but I might need to get back to you on that one. Yeah, sure.
Okay. So a very interesting question here is about the road to, if this is a vital tool for parents, when and how can they be taught to use it for themselves? I suppose I'm now adding an extra to this question. I don't think everything in there is possible to train a parent to do, because you need a special skill, but those that are within their, obviously their skill set, or they can do it easily, when and how can then, so that they're also like actively, contributing to this early detection, as opposed to just proactively going and having it done and not seeing it as a thing that really requires doing.
Yeah, I think it's a good point around reinforcing the messages that we're trying to promote around growth and empowering. We use that word so easily, but this really is an empowerment opportunity through education or through training or through connecting the parent to this book, that they feel a part, and it's not like a disconnect to say, oh, the nurse will do this, or I don't understand, I'm not sure. And it can be quite technical. And I think part of my journey in this, to say, because I'm not a health professional in a medical form, in the true medical sense, I've found my confidence, I suppose, by engaging and exploring in this interdisciplinary space. And as I've done that, I've gained confidence. And so watching parents do that at any level, I think, is significant, because we forget often that they are the actual ones, because they are the caregivers, and they could utilize and should utilize this information to support the activities that that child is doing, specifically if it's developmental, and we want to be supporting the parent to do that. Whether there's time constraints and pressures involved and lack of resources, those are all very real realities, and a parent can take a proactive role. And so through parent education programs or contact with parents, I think we can start to, one of the questions I saw was around, like, how do we do this? And I think it is about creating more connection points than less for parents with this booklet, so that they feel a part. And we're not expecting parents to complete it. We're asking them to be a part of the conversation around their child. And what that does is put the agency with them and empowers them to, that the results are theirs. For those of you who've ever waited for test results and then not really known what those test results mean, it's kind of that experience, of wanting to better understand these really technical concepts, or and I think the side-by-side efforts have been tremendously supportive of communicating public health messages in an accessible way, and we can still do more. So, no pun intended.
Fantastic. I mean, the chats, the questions, it's all coming at full speed. Unfortunately, time does not allow us to answer all and every question. That is not to say the conversation ends here. Do reach out to the authors. Dr. Jessica Ronaasen is one of them. She will also link you up to the other authors on the paper. We are always happy to facilitate connections and to share resources that we have, or our partners are actively producing. So for those of you who could not get your questions directly answered or didn't get opportunity, please reach out to us. But Dr. Jess, it's been a very, very interesting and insightful conversation. Thank you for sharing your research findings with us. And from what I'm gathering from some of the questions, I think we need a rural perspective as well. Because if we are seeing these challenges or gaps, I'm assuming it can be amplified in a very stark situation for mostly rural places. So I'm seeing a part 2 of the paper, a homework for you. But thank you for sharing the findings with us, and we hope to hear the part 2 in the near future.
And thank you to such an engaged audience, and also the soft place to land in terms of bringing a health topic into the early learning and ECD space. So
fantastic.
Thanks
Well,
so much.
colleagues, this brings us to the end of this morning's conversation. Join us again next month. Next month's webinar will be on the 15th of April, where we are going to explore determinants of school readiness in South African preschoolers. So we are going to look at numeracy and literacy skills to see how preschoolers in the country are ready for formal schooling or grade 1, I suppose. So please, you don't want to miss that one. Thank you for your time, and please watch out for the recordings and the slide deck and all the other resources on our social media platforms. Have a good afternoon.